be here and representing the United States. And thank you so much to all of our hosts, both from ISCA as well as from France. Just delightful to be here. It's my first trip to Paris, so I'm getting to enjoy some of the sights as well. Came in a day early and stay a day late, hopefully. So I only have 25 minutes. Talking slowly and with only 25 minutes will be a challenge for me, but I will do my best. So Mogans, if I get you just like tell me to slow down. Okay, gotcha. All right, I'm going to assume green is forward. So as you heard, I work with the President's Council on Fitness, Sports, and Nutrition. And our council is made up of what I will call celebrity athletes, as well Olympians, professional athletes, physicians. We just got named 2 days ago a wonderful physical educator. So we really have people from the grassroots as well as national and international sports stars. And our challenge, of course, is to be able to utilize the cachet, if you will, of these members to advance our mission. And of course, we are not just about sports. We're not just about elite sports specifically. We're about sport for all. We're about physical activity. We're about quality physical education in schools. And now we are about nutrition. We just added nutrition to our name a little over a year ago. And so these are the types of people that are represented on our council. We have 25 members that are volunteer. They are appointed by the president as well, and we put them to work. And they go out and they are spokespeople and represent us all across the country, both at national and international events, as well as at local events in schools and after-school programs and the like. So facing the challenge, I'm going to breeze through this because many of you know this already and can get this information, but as we talked about it, and you know, we seem to focus a lot on obesity these days versus physical activity or nutrition, and it's a little bit concerning to me, quite honestly, just this focus on weight all the time, but it seems to be getting us more dollars, doesn't it? Some of us, we get a few more dollars if we talk about obesity. And so we're going to ride that as long as we can in America as well, because that's where the money seems to be flowing, if there is any to be had. And so we hear a lot about obesity, and I'm sure all of you know your rankings and so forth. And then to talk about physical inactivity is now identified as the fourth leading risk factor in global mortality. The fourth leading risk factor in global mortality. How can this be? And main cause of approximately, 20 to 30% of main causes of death in the disease burden in our respective countries. So clearly, we are all here for the right reasons, and I would suggest that we are all here at the right time for the right reasons, working on the right mission for our respective countries and the planet. Again, here's some nutrition facts. Maybe you know this. I'm going to breeze through it so I can stay within my time frame. And here we are in the U.S., where our obesity rates have tripled in the last 30 years. 1 in 3 kids now in America is either overweight or obese. 1 in 3. Less than 1/3 of all children ages 6 to 17 engage in vigorous activity. And 34% of our adults over 20 years old are overweight, another 34%. So about two-thirds of our adult population is either overweight or obese. 2/3 of our adults. So let's do our quick little survey. So how many of your countries, so green is yes, orange is no. How many of your countries let me see how I can phrase this. Green, if your country has at least 2/3 are overweight or obese for your adult population. Green, if it's 2/3 or higher. of you lower. Most of you lower. Okay. So U.S. is leading in something we don't really want to be leading in, is what I'm hearing and seeing. Okay. So good for you all. You are not there. And hopefully you're headed in the opposite direction, which is where we all want to go. Clearly this impacts our healthcare costs. Our ability to compete in the global economy is absolutely impacted by our obesity rates. And of course, healthcare costs have a lot to do with that. And of course, if we look at national security, right now, 70% of young people are turned away from military service in the United States for one of three reasons. They don't have a high school diploma, they have a criminal record, or they can't pass the physical activity exam. They can't even get in. And that doesn't count the ones that get in, but can't make it through the boot camp and the preparation that is needed for military service. So when we talk and when we try to make our case to our Congress, to legislators, to funders, we make this case on all of these areas, that we can't afford not to be investing in quality physical education in schools, in good youth sports programs, and in after-school programs, and all of the things that we're here to talk about over these next few days. Now this is kind of a fun chart. I don't know if anybody's seen this. So we have our Centers for Disease Control and Prevention. And they've gone all the way back to 1985. And these are all of our different states. We have 50 states. And so the lighter blue says that less than 10% of the population, adult population, was overweight or obese. The medium blue, the medium blue that you see here is what? 10 to 14%. This is 1985. 10 to 14%. Let me just show you what happened. There's 86, 87, 88, 89, 90. Now most of our states are at least are over 10%. There we got a darker blue now. So the darker blue is 15 to 19%. 15 to 19% for the darker blue. There's 1993, 96, 97 we had another color. Now we're at least 20% overweight or obese. This is adults. 2001 we have to add another color. 25% overweight or obese. 2005 we add another color. 30% of the population in those states overweight or obese. And then we arrive at 2010. Not one state now in the blue. We did have Colorado. If you're going to move to the U.S., Colorado's your healthiest state. just so you know. All right, so we are moving in the wrong direction. And we can talk the next 3 days about why that is and what's going on. But the bottom line is that we all need to be working to move us in the right direction, because clearly this is not the right direction. There are significant barriers. Many of us know what those barriers are. In our country, only 1 in 5 homes have parks within a half mile. And we know that if people don't have parks within a half mile of their home, they're not going to it. They're not going to go there. Every community, not every community has access to sports fields or gyms or skating rinks. And we have limited investments overall in walking and bicycle trails. Now, do we have models in our country? Absolutely. Do we have built environments that are to die for in a positive way, that are really awesome? Yes, we do. Yes, we do. Access to affordable and healthy foods. We talk a lot about food deserts, where people in those communities do not have access to affordable, healthy foods. And the new term that is being coined now are food swamps. You know what a food swamp is? That's where you just have a glut of unhealthy foods. That's where you can find the unhealthy foods on every street corner, but you can't get the healthy stuff. So that's the new verbiage that's going around. So what are the solutions? That's why we're here, right? We're looking at solutions. Well, I'm happy to report that in 2010, the White House, the President and the First Lady, and led by First Lady Michelle Obama, started the Let's Move initiative. And this initiative is to solve childhood obesity within a generation. Solve the problem of childhood obesity within a generation. This is no small undertaking. What I love about Let's Move is that it's really breaking down the silos within our government. So we have our different departments of agriculture and education and interior and transportation and health are all working together now. The silos have come down. We're communicating, we're talking to each other, we're finding out what each other is doing. And we're coming up with solutions. And the solutions aren't just all willy-nilly everywhere. They're now very much concerted and working together. We have 5 pillars related to Let's Move: creating a healthy start for children, empowering parents and caregivers, because our focus is on children, so obviously we have to look at who the caregivers are, providing healthy food in schools, that's a big one, right? And we actually passed a bill in our Congress called the Healthy Hunger-Free Kids Act, which is now getting healthier foods into our schools. It will take a while for it to all go into place, but it is already working. We're seeing healthier foods in our schools. We're seeing schools being able to buy local produce, and use it in their schools, which is really fabulous. And improving access to healthy and affordable schools. Again, that's where those food deserts. We have a healthy food financing initiative, which is incenting companies, incenting stores to be built or opened in areas where fresh foods and vegetables heretofore have been absent. So there's financial incentives coming for that. And of course, increasing physical activity. There are many Let's Move programs. We have a cities and towns where local municipalities, mayors, and local leaders are engaged. We have a whole faith and communities movement. We have a Let's Move in school, Let's Move outside, and so forth. And our newest one is Let's Move childcare. So really getting at the early childhood arena. We have online maps. We are matching up chefs with schools to help come in and help retrain our food service workers on how to create healthy menus and utilize healthy menus within their very small school budget for schools. And so we're matching up that expertise with the schools. And again, so there's a whole lot of kind of geo-mapping going on. We also have, through our Centers for Disease Control and Prevention, a Communities Putting Prevention to Work grant. And so these are funds that go out to communities who have a comprehensive approach to moving this mission forward. So that is one way that federal government is stepping up, that we are putting prevention dollars into this cause. We have healthy people. How many have heard of our healthy people? Healthy people, we've had healthy people 1990, healthy people 2000, healthy people 2010, now healthy people 2020. So every 10 years, we update our goals and objectives. And the book is about that thick. And we have lots and lots of goals and objectives, not just for physical activity and nutrition, but for all sorts of areas of health. So there's much more on that, and probably lines up with some of your work in terms of national setting of objectives and goals. We have a Surgeon General who, again, certainly supports this mission among all of the other things that she is about. And so we're happy to be working with her office. We have many success stories across the country. And, one, if you see the bus over here on your left, that essentially is a mobile farmer's market. So that bus is just loaded with fresh fruits and vegetables. It goes around to those neighborhoods that don't have a farmer's market, that don't have a store where you can buy affordable fresh fruits and vegetables. So that is, I forget the name of the bus now, but it brings fresh fruits and vegetables to those communities. We have many wonderful programs that improve physical activity for all ages, including kids and people with disabilities. That's a huge movement for us, is making sure we're addressing all people this movement. And we are able to really ramp up the work that we're doing. And many of us, of course, have worked our whole lives, our whole careers in this area. And now to have the auspices of the White House and the First Lady to say, hey, this is important, and really shine the light on what we're doing and so many others, it has really allowed us to make even more of a difference and really elevate our work. So 3 things. Our 3 pillars for the President's Council, specifically for the President's Council on Fitness, Sports, and Nutrition, are fitness, sports, and nutrition. And under the fitness pillar here, we talk both about physical activity as well as physical education. Under sports, it's really sport for social change, sport for all. And how can we really make sure that we are addressing sports and youth sports specifically to make sure that we're reaching all kids everywhere. That's where we're headed. And then better access to an understanding of proper nutrition. Some of our other departments, agriculture and others, are really leading the way on nutrition, and we're helping to stand up what they're doing. We're not inventing new things as it relates to nutrition. We're simply making sure that we're lifting up what's already there. Now, one of the ways that we really that we promote physical activity is through a kind of awards and recognition programs. None of this is exceptionally innovative, but what we do have is the imprimatur of our president and now our First Lady. And so we have awards and recognition programs such as our Presidential Active Lifestyle Award. And we've made it really cool for kids and adults to get this award. And so we've seen even in the last year, in the last 12 months, we set a goal of having 1 million people achieve this award. And I'm happy to say we blew that goal out of the water and hit 1.7 million. People that were not heretofore, or were not previously active, are now active. And now they're continuing on with other programs and projects. That same program we've now added nutrition to. So now it's physical activity plus nutrition, PALA plus, activity plus nutrition. Again, some of you may have programs similar to this. What we've been really happy with is that we've had the imprimatur of the First Lady and our President to really push this forward. We also work a lot with our military families. These are families that are very, very stressed. They've seen their loved one deployed and deployed and deployed. In the respective wars that we find ourselves in. And the families that are left behind to carry on are extremely stressed. And so we look for ways that we can support those families. So we went to 2 organizations. One organization called the International Health and Racket Sport Club Association, which is all like the fitness clubs, health clubs and fitness clubs. And we said, we need you to give free memberships to military families. We need you to at least set a goal of 100,000 free memberships for military families. They said, yes, Shelie, we're in. And then we went to the organization ACE, the American Council on Exercise, that has all of the personal trainers, fitness trainers, personal trainers. We said, we need you to give free personal training to military families. They said, we're in. And we said, okay, how about 1 million hours? They said, okay, we're in. They hesitated a little bit. But 1 million hours they're giving of personal training for military families. And that's the spouse as well as the kids for both of those as appropriate for those memberships and those free memberships. So that is really something that that is very meaningful for us in our country at this time. The I Can Do It, You Can Do It program is a program specifically for people with disabilities. This is Jacob. That is along the Chicago shoreline, and thankfully, because people that care, they make sure that there are the right bicycles, the right equipment, and the right opportunities for kids with disabilities to get out. There are more pictures that would show you kids out in kayaks. These same kids that are off their bikes and are out in kayaks out in Lake Michigan. So really cool. A couple last things on resources, and believe me, this is very condensed presentation to fit our timelines. We do have physical activity guidelines. I guess hold up your green card if you have physical activity guidelines for your country. Yes? No here? No for orange? So we have quite a few greens, a few oranges. And so you have specific physical activity guidelines for your country. How about dietary guidelines? Yes for green, orange for no. Maybe a little over half, yes, but lots of no's. Well, Kelly's going to talk about her guidelines as well. She has physical activity guidelines. We have physical activity guidelines. I'm sure any of us would be willing to share if you're looking to create guidelines for your country. And it may or may not be appropriate for your population. So those are available. There are the dietary guidelines. They just came out this past year. And I was not involved with them, thank goodness. Because it's always a hornet's nest when you're talking about what people eat, right? But those are the best that our folks put forward. I think we're very happy with them, and we'll continue to update those about every 5 years is how those get updated. Again, we're doing more geo-mapping as it relates to food deserts, and what I want to do is look at play deserts or recreation deserts, because I will tell you that we have a lot of those as well. So that is being worked on. There's our new My Plate. Some of you remember our pyramid. Pyramid is out, the plate is in. So there's our new My Plate. We have a National Physical Activity Plan. This is not a government plan. It was really done by all of our constituents, our partner groups from across our country, which makes it really fabulous. So this is not some government document that we're giving out and it's going to sit on somebody's shelf. This is a document that was done by a coalition of organizations from across our country that came together to make it work. Now we're working on how do we implement it and who has what piece of the plan to implement. Healthier U.S. School Challenge is something our Department of Agriculture operates, and that's just that. It's working with schools to make sure their lunches are meeting the new recommendations, to make sure that kids have enough time to eat, and making sure that they also have enough physical activity. Safe Routes to School program. This is a part of a federal program out of our Department of Transportation to get kids to school. We have the walking school buses now. Walking school buses where parents are picking up kids along the route and walking them to school, taking turns and so forth. It can be done. It can be done. Probably like many of you, we are seeing where kids, we are siting schools. We are building schools where kids cannot walk or bike to them. because of interstates, because of this or that. We are not building schools where we can walk or bike. And so this is a problem. This is a problem. And we're building schools without gymnasiums too, by the way. Without gymnasiums. So once again, we've got to make sure that we're building the necessary framework to allow us to become a healthy, vital nation. To end, you'll see some pictures here. I would just say that all of us here today, this is our time. This is our time. Never before, in my opinion, has there been such a worldwide impetus and outpouring for our mission. And you saw that 2 months ago now, no, last month, at the United Nations meetings in New York City, where non-communicable diseases was the topic of discussion. And certainly our piece of that was very much front and center. And so we're seeing now, through the WHO, through United Nations, and up and through all of our respective organizations, that the time is now. We've got to redouble our efforts and make sure that we're creating metrics, that we're able to measure our success, and to be able to put that success forward, to show that our investment is the most positive thing that our organizations, our countries, our funders can do to move our again, respective nations forward. Thank you so much. I've got a couple things there. Thank you.